Hello, today I will talk about some types of OCD. The most famous type is the uh, OCD about dirt and contamination, and this will force the sufferer to do excessive cleaning. Uh, his compulsion will be excessive cleaning. He will try to get rid of imaginable germs or bacteria or dirt or contamination in his head. The other famous one is the violent or harmful OCD or harm OCD, and it can fall in one of these categories. It can be more, but I will try to mention the most famous one. Images of doing something horrible to a loved one, like your children or grandchildren, throwing your baby off the balcony as an example, stabbing your grandchildren, and like that. Some other urge to harm a loved one, urge to push a loved one off the bridge or to stab the loved one. It doesn't have to be your child, but anyone whom you love. Okay, doubts as to whether you have accidentally harmed someone. The most famous example for that is that when you ride with your car and then you try to go back because you get an obsession that maybe you have killed someone or you have run over someone or like that. Okay. Uh, Sometimes also you suspect that you have done something a poison in the mealtide or in the food of your beloved one or of your friends. Maybe when you cooked the dinner, maybe you didn't clean very carefully the dishes and the plates and the spoons, and so they will catch a disease, and then you will uh, the obsessions of harmful things will come back to you, and you begin to think about them. Then of course you get an anxiety, and after that you will feel the fear really and the sensation of the fear, and then you will, of course, you know it, you will do the compulsion. And the compulsion can in different way. I will not say specific compulsion, but you will try to decrease your anxiety. Another types of obsessions or OCD is with sexual content. Okay, sexual thoughts that one views as inappropriate. It is always inappropriate for you and unacceptable for you. It is always. Uh, and it can fall in one of these categories: thoughts or images of engaging in a sexual act that you find personally disgusting. It is always like that. You find uh, uh, you find these images or thoughts always disgusting. Okay. Uh, Also, it can be images of touching a child sexually, images of engaging in a sexual act that goes against your sexual orientation and repulses you, of course. You can also get urges to engage in exploitation or exploitive and personally disgusting sexual act. Urge to touch a woman in the church or in the street, or urge to make a sexually crude comment about someone. Okay. And one which enters under gay OCD or homosexual OCD is doubts about your own sexuality, about or not you are a pervert or a child molester. Uh, did I become sexually aroused when I hugged this child? Uh, okay, so you think that you are a pedophile, as an example, or you feel as a pedophile, and you use your body sensations or your uh, feelings uh, as a proof that you are a pedophile, and at the same time, of course, you are seeking help to get rid of these feelings and emotions, because you feel from deep inside that this is not you. Okay, but we will come later to more to describe how can you decrease these obsessions, or how can you deal with these obsessions, and what should you do. Okay, but now I'm simply mentioning some types, and so that you can recognize them. Okay, but in fact, all of these types follows the obsessive compulsive cycle. Okay, that I have already explained in some videos before that video. Okay, uh, then you after the doubt about your sexuality, and then you begin to doubt. Uh, as an example, when you are watching TV or you are walking the street, then you begin to ask yourself, why did I linger on that TV station? Because the shows featured children, or maybe homo people, or like that, or something from the other sex, or so you doubt, and such thoughts or obsessions comes to you. Did I become sexually aroused by seeing other naked men in the dressing room? Okay, this is okay. The other important obsessions is the religious themes obsessions, uh, or it can be in a moral sense, and it can be in religious sense. Okay, thoughts or images of engaging in a sacrilegious act, and or the pleasing God, images of religious figure engaging in a sinful or blasphemous act, ideas such as I am condemned to hell, or the Spirit of God has left me, God has left me, uh, and you begin, of course, as a compulsion to do something to ensure that God doesn't left you, so you will do more prayer or more supplication or more religious acts, of course. Okay, but also you can got impulses and urges, sensations, really feeling, and you get urged to, as an example, to curse the religious figure that you adore, urge to say something blasphemous inside religious ceremony or during religious ceremony or while praying. Okay, general doubts. It can be also general doubts. Did I put my own desire before God? Uh, did I sin but I forgot to repent? Okay, did I sin but I forget to repent? Is God showing me a sign? So you see different action or thoughts, and then you use them as a sign that God is displeased with you, or maybe sometimes pleased with you. Okay, and then you will begin another question or doubt, to doubt if God really pleased with you. So if you think that he is not pleased with you, you will get some story, OCD story, okay, OCD content, deceptive causal content. And if you get positive uh, story, religious story, then this will remind you about some negative religious story, and then you begin also the story of religious OCD. The content can be 1 billion types and 1 billion forms, and can over everything. You can get religious OCD over everything, over air. You think you connect the air that you breathe, and that you curse your religious figure. About color, when you open the holy book, it can be even with something that completely have nothing to do with religion, completely. Okay, a sort of color or air or uh, type of anything it can be. So this is very important, because a lot of people cannot feel this warm feeling with God because of this religious OCD, religious obsession. Okay, doubts that reflect scrupulosity, or extreme rigor and thoroughness. You become very rigorous in your thoughts, very decisive, very white and black. Okay, and also in following religious principles, you become very strict, white and black. Uh, or sometimes you get scrupulosity about not religious but moral. If you are not a religious guy, or so, it can be that you don't believe in a religion or a god, so still you get scrupulosity, OCD. One of them is moral OCD, or responsibility OCD. It is very famous, responsibility OCD and moral OCD, but of course it is hidden, because this is it has an internal, first it has an internal compulsions, so internal behavior that you try to correct or to decrease your anxiety, so no one will see it except you. Okay, was I completely truthful in telling my friend about such and such and such? Was I truthful when I told someone exactly what was on my mind? Did I tell him exactly what was on my mind? Okay. Could I have been misunderstood? So now you suspect that maybe you told the whole story, but maybe he has misunderstood you. So you read his thoughts. This is also a type of cognitive error, but okay. So it will create an obsession. I didn't tell that story completely, so you begin to obsess about that. And that will mean you will doubt, suspect about salvation or about hell or paradise and like that. Okay, also you have what is called pure OCD. And pure OCD is they say pure OCD, but it is a misnomer, because there is no such thing as a pure OCD. Always you get the obsession and the compulsion, but the compulsion in this type, what is called pure OCD, is internal. So you discuss, or you begin to challenge, you fight, you struggle with the thought and with the feeling. So they call it pure OCD. You can call it also internal ritual OCD. Yeah, the name is not important. Okay, there are also another types of OCD. Maybe it is less common, but it is worth mentioning. There are some types also about obsessions about the body image, like the shape of your nose, the shape of your eyes. Is it correct? Uh, they call it body dysmorphia, or BDD, body dysmorphic disorder, and it is related very much to OCD. Okay, a lot of people commit as a compulsion, uh, as a compulsion, and uh, to correct this image of you, a lot of cosmetical operations. Even some of them can have 10, 20 operations to correct the body image in his head. Not it can be a beautiful woman, a handsome man, but still he feels really deep inside He feels, he senses, he see it also in the mirror. He see it as an ugly, uh, a big nose, especially the nose, is a focus of concentration in the BDD. Okay, there are also hoarding or saving obsessions, OCD. It is the person get inability to discard anything because it may be needed sometimes. A fear of losing something or discarding something by mistake also. Uh, there are another OCD about having things just right. In fact, this is can be a standalone OCD, or it can be a part of many OCDs. You don't get this stop signal to stop. This is enough. It is enough. No, you don't get that. So you always check your feelings to see if it is. You check your feelings not consciously but automatically to see if it is. Should I stop or not? Like switching the light on and off, or correcting something, then you, or closing the door or checking the windows, you still doing that until you get the sense of safety, of it is enough. You don't get that. Maybe after half hour or 4 hours you get that. So this is a sort of checking or just right OCD, which can be in the form of checking OCD, or another form it can be also. There is also ROCD, or relationship OCD, is a subset of OCD, which the sufferer is concerned and consumed with the doubts about the relationship. They question their lover for or their partner about, sometimes about any movement they do, or about any uh, thing they hear. They check the schedule, the time schedule, they check the agenda, they check telephone, they check everything. They suspect that they are their partner is cheating on them, or they suspect that they are cheating on their partner. So uh, it can be indifferent that they are not loyal, or their partner are not loyal. Uh, uh, their partner doesn't love them, or they themselves don't love their partner. It is a very strange OCD, but okay. So all of the OCDs are in fact strange, because I always say that OCD is a very strange. You see, this guy is calm, is a good guy, is a intelligent guy, or of course, or a woman, man or a woman. They are well behaved, but only in this point, only in their OCD theme, they are crazy. Okay, look like crazy. They are not crazy, of course. They are very good, nice people. Okay, but only in this they are completely illogical, completely unbelievable. Okay. Now I come to a very also important OCD, the postpartum OCD. I should here stress that I got uh, many times women, after waiting for a child for 10, 14 years, sometimes 17 years, 14 years, 10 years, 8 years, for a long period, they wait for a child, and suddenly they get that child. Uh, the child is born, and the woman is breastfeeding the child, or at the night she try to cover him simply with a blanket, because she feel that maybe he get cold, and suddenly a thought enters her mind that says, what will happen if you put the blanket on the face, or if you put the pillow on the face or on the nose of your child and you kill him, what will happen? Then a second thought will come: what sort of mother you are when you are thinking thoughts like that? And then anxiety, fear, I'm not good, I'm not, why I am having this, that, so this why will uh, make the things worse, or make the thing worse, more worse or worse. Uh, and then she will get depression. She goes to the doctor or some untrained psychotherapist, and he will say to her that you have depression, or you have like that and like that. Most of the depression in OCD, uh, it is the cause of OCD. T Tell me, how is it possible that a man or a woman have such thoughts, OCD thoughts, OCD obsessions and compulsions, and he is not depressed? He will be eventually in depression. So this postpartum OCD misdiagnosed very often as an depression, postpartum depression. And in fact, it is in postpartum OCD. Or it can be diagnosed as general anxiety, or maybe in very severe cases as a psychosis, or later as a schizophrenia, and she will get the medicine for psychosis. And the problem there is not that. The problem there is postpartum OCD. The child for her was a very great value, very big value, and for some reason or other, she get this obsession, and she okay. Uh, okay, so this is the postpartum OCD. It is very important. There is also hair picking OCD, or trichotillomania, and skin picking OCD. They are in fact on the border between OCD and tic disorder. So you should judge these OCD types according to the content and to the thought content or cognitive content. If they have a lot of thought and cognitive content, then they are on the OCD side. So you use behavior therapy or ERP plus, or okay, or our the of course the 4 steps is also an ERP plus, I say ERP plus therapy, the therapy that we are using. Uh, okay, if it is on the OCD side, so a lot of thought and cognitive content, then it is on the OCD side. Then it has a lot of behavioral therapy component. If it has these the hair picking and the skin picking, if it has less cognitive or thought content, then they are more involuntary. So they are on the tic disorder side, and then you should use tic disorder therapy like behavior habit reversal therapy. It's also a behavior, but it has also a mindfulness component, but it is a habit reversal, and it is a little bit different than because of than the normal OCD therapy, because of there is no or much less thought content. Okay, so but for this you need also a good therapist for skin picking and hair picking. Okay, and I come to the end, and I will talk about hyper awareness OCD. It needs a special attention, in fact, because uh, it can happen uh, um with each OCD, by going layer deeper, so noticing the noticing. Now, okay, I prefer not to say it in front of the maybe. Okay, but it is about noticing. So you notice the thing, and then you become aware that you are noticing, and then you refuse this experience. You refuse noticing what you are noticing. Okay, and it can be in two types. It can be about body sensation like swallowing or breathing or blinking the eye. Okay, so you become aware of blinking. Until now there is no problem, but now you become second time aware of your blinking, third time aware. Then you want to get rid of blinking. You cannot, so you keep focusing on blinking, and then you become aware that you are focusing on blinking. You notice that you are noticing your blinking. Okay, and then you refuse that. You fear that. You think that why I'm doing that? Maybe uh, it will be like that forever, and my life will be destroyed because I cannot concentrate on something else. I'm always concentrating on that. And okay, the same thing with the breathing. So you breathe, and uh, you become aware of the sensation of the breathing. Of course, in mindfulness, this is why sometimes you hear in this type as a mindfulness exercise. Maybe I didn't say that in the mindfulness, but maybe in this type you should focus on another sensory input signal. If you have a breathe OCD, okay, hyper awareness uh, breathe OCD, focus on breathing, then you should use as an example some sound as an anchor for your mindfulness. Okay, so it is important to know that a sound or a vision. Also, you cannot use now the breathing for your as an anchor for your mindfulness practice. No, you should use another sensory input. Okay, so you become aware of your breathing, and then you notice that you are aware of your breathing, and then you refuse this noticing. Why I am noticing that I am noticing my breathing? So if you refuse your experience of noticing, and then everything that you want to get rid of it, and you insist on getting rid of it, then it will stick. Yeah. So okay, this is why a big challenge is to accept that you are noticing. No, I don't say that you should practice noticing. No, if you notice that you are noticing, then accept that. Acceptance. This is of course, this is not the place to discuss the therapy, but to explain the therapy. But okay, I simply saying it. Okay, so or you become aware of your blinking, or sometimes ringing in the ears. Okay, if you focus on it for, you become aware of it, and then you notice that you are noticing the ringing in the ears. You refuse this experience. Okay, the same thing with every blinking, swallowing. So of course sometimes you get everybody who get cold. In fact, all of us had gotten the hyper awareness OCD when we had cold, um, because it is something different here. So we become aware of this region. We focus here, and then because it is for 3 or 1 week or 2 weeks, then we become extra aware here, and then we notice that we are extra aware here. But because we know, let us say we know that we have now cold and it is not a big deal, it is not a big problem, then the sensation, the noticing of the noticing will go away. There will be only noticing, so only first, no metacognitive or meta-aware. In fact, it is also not a meta-awareness, because in meta-awareness you should accept when you notice that you are noticing, you should accept that you should not feel pain, not feel agitated, not feel anxiety when you are noticing that you are noticing. No, you should accept that you are noticing that you have something because of the cold here when you swallow or in your nose. If you accept that, if you accept the experience, then gradually the sensation will go away and the noticing of the noticing also will go away. And yeah, and you will get rid of it, of the noticing, and then of the noticing. Everybody notice some activity of the body between time and time, but when you try to push it to get rid of it, and you insist on getting rid of this noticing, then it is stuck, because everything you want to get rid of it, you become afraid of it, you fear. If you fear, then you will activate FFF, fight, flight, freeze response. If you activate flight, fight, freeze response, then everything become automatic, and you will feel the fear. You will sense the fear. You will think the fear, and everything will stick, because nothing. The the biggest glue for the thought is fear. Attach any thought, any sensation, any feeling to a fear, and it will stick forever. Okay. So acceptance is the big word here. The big challenge here is to accept. Okay. Okay. Now you get also hyper awareness in thought processes, and now here a lot of untrained therapists can misdiagnose that for another type of medical disorder, like psychosis. Okay. So you become aware of your thought, you notice them, you notice your thought, and then you notice that you are noticing your thought the whole time. So the sufferer will begin to. In fact, this is a very common that you are noticing your thought, noticing your thought is accompanied with most of the OCD types, but not the whole time. So he can get a dirt or contamination OCD, or pure OCD. It can be about harm or any other type, pure OCD. But at the same time, he is not only aware of his thought, no, he is aware of, uh, he is noticing the noticing of his thought. And so sometimes he can hear or see these thoughts. He, in fact, he don't see these thoughts, and he don't hear them. He don't hear them. He feel that he hears, because he is noticing how he's noticing his thoughts. So he's lost in the noticings. So he think that he hears them or seeing them, and it can be misdiagnosed for hallucination, visual hallucination or auditory hallucination, and later misdiagnosed for psychosis or schizophrenia, and then he got antipsychotica medicine, and this will exacerbate his OCD problem, because it is not the good medicine, the good description, the good diagnosis. Okay, so this is in general some types of OCD, and I hope that you have benefited from that. I hope. Okay. If you don't have OCD, then thank God you don't have OCD. I mean, but if you have an OCD, maybe this can help you to begin to search for the appropriate therapy ERP or ERP plus therapy or another behavior therapy, but should be, of course, behavior and cognitive, but mostly OCD is a behavior thing. If you want to change your brain, you should uh, ultimately use behavior. Behavior is changing your brain. Okay, thank you and bye bye.